Hello, I'm Ole Norheim. I'm a physician and now a professor of medical ethics and director of Bergen Center for Ethics and Priority Setting in Health at the University of Bergen in Norway. My own research focus is about ethical principles and criteria for priority setting. We want to explore how to combine a concern for equality, these are called egalitarian principles, and how to maximize health in the population. These are called utilitarian principles. And I'm especially interested in ethical theory called prioritarianism that tries to integrate these two concerns. And this is also applied in the question of how to integrate fair distribution into methods for economic evaluation. My research group at BCEPS is called the Rationing Lab. How do we allocate scarce health resources in a fair and efficient way? And decision makers have to make choices with scarcity, and this will affect people. And therefore we test out different ethical principles and see how this would play out at the population level. BCEPS has a vision. It's better health for all, more fairly distributed. And this captures the key concerns that we work in at BCEPS, because there are both at the global level and at the national level, there are huge inequalities in access to care and health outcomes. And at BCEPS, we aim to understand and promote ethically acceptable, fair and efficient priority setting. And we do that by working interdisciplinary. So we try to combine ethical perspectives, economics and health economics, clinical medicine, epidemiology, and health policy. Why do we have a center for ethics and priority setting? All countries struggle with resource scarcity. There are big needs and we cannot afford to do everything that is possible to do. So decision makers at all levels, nurses, doctors, hospital directors and people working in the ministry and politicians have to make decisions, and they often affect life or death. Who should live, who should die? And these have to be explored and justified by medical reasons. How much can we help people? What's the effectiveness of our interventions? What are the costs? These are the economic reasons. But there are also ethical reasons. We want to justify our choices and the choices that decision makers make based on what can maximize health in the population, but also how can we distribute it more fairly? How can we make sure that no one are left behind? How can we help the worse off? And this needs an independent, impartial group of people who work outside of day-to-day policy or decision-making to explore these difficult choices. And then we try to provide evidence and normative guidance to decision makers at all levels to help them make these difficult decisions. A little bit about BCEPS history. It started in the early 2000s where Tore Godal, one of the grand old men in Norwegian global health, he saw the need to establish such an independent, impartial group of researchers. And we got support from the Norwegian Development Agency and later Bill and Melinda Gates Foundation. So we have used these resources to explore our methods and our ethical thinking and also train people, and we supported the government of Ethiopia and the Ministry of Health there to define and refine an essential health service package. And we did that by both providing evidence, doing new analysis, and also training people, civil servants from the ministry. One of the Norwegian philanthropists, Trond Mohn, they also saw that this was interesting, and they supported us and asked us to expand this work together with support from NORAD to expand the work to other countries. So we started to work also in Malawi and Zanzibar to support the governments there to refine and redefine essential benefit packages. And later on, NORAD asked us to even expand more. So now we work in Ghana and Tanzania mainland. We also work in Nepal, and we are supporting Africa CDC and the health economics program there. So we aim to make an impact by providing evidence and normative guidance. We have a lot of international projects and partners, and just to mention a few of them, we work closely with Harvard Chan School of Public Health, the University of Pennsylvania, and the University of Washington. And we also work with local partners in the south, such as Addis Ababa University, University of Ghana, Muhimbili in Tanzania, Kathmandu University, and we work closely with the World Health Organization and the World Bank. At BCEPS, we aim to have an impact, to make a difference. Both academically, we try to publish, and we have succeeded in publishing high-impact publications in good journals that are widely read. We also publish more technical papers, both in ethics and in health economics and priority setting. We organize conferences, we participate in high-level meetings, and we also do capacity building and training of a new generation of researchers and policymakers. We also want to have a real impact on policy, so we provide decision support at high level, providing data, tools, evidence, and also training. And we think that is so important for ownership at the country level, that people have the capacity and expertise to make their own analysis and make their own decisions about fair and efficient priority setting. In addition to that, we work closely with the World Health Organization and the Unit for Health Financing and Health Economics, and we have worked with the World Bank on a report on open and inclusive deliberations for health financing. And finally, we want to have an impact and work with the public. Decisions about life and death, about priority setting, who should have access to what kind of services, is about trust and legitimacy. And this is very important because people have to support the decisions that are made on their behalf. So therefore we try to educate the public, we write op-eds, we want to communicate our research and our recommendations and be involved in public discussions about priority setting, both in Norway and in the countries there we work. And we also have an open access policy for all our publications. So you're welcome to follow all this work, the publications, the reports, and the guidance that we provide on our website and on social media.